Hey guys, so we're doing blood vessel anatomy today. So, first off, we're just going to talk about where blood goes when it leaves the heart. So, we start off with blood in the heart. Okay, it's going to be entering our ventricles. Our ventricles contract and they will push our blood out into our arteries. Once again, the definition of an artery is going to be a blood vessel that is carrying blood away from the heart. Arteries will be our larger blood vessels carrying blood away from the heart. Arterioles are going to be little arteries, hence ol. Ol means little. So we'll have little arteries that will be branching off from larger arteries. And those little arteries enter these little beds called capillaries. Capillaries are going to be where we will exchange gases and nutrients from blood into our tissues. After we've done our capillary exchange, we will continue on to do our venous carry, which means we're going back towards the heart. So we have venules, which are little veins, and a bunch of little venules get together to form veins, which are large, and those will empty into the heart. Now let's talk a little bit about blood vessel anatomy for the blood vessels themselves. First off, this little picture right here that I'm squaring over is a slide of an artery and a vein. As you can see here, this artery retains its structure and it has a nice circular or oval shape to it, versus this vein which has a big old flattened type appearance going on with it. So let's talk about why we're going to have these different parts. Alright, we'll show that on the next slide. First off, arteries and veins will have a lot of similarities to one another. I like to use this mnemonic TIME, which means tunica, intima, media, and externa. So both of these will have a tunica intima, which is an inner layer of endothelial cells. It's this yellow stuff right here. And that'll just be a single layer of cells, simple squamous epithelial cells. Okay? Where arteries are going to have something a little extra versus veins is inside their tunica intima, they're going to have an internal elastic lamina. What that means is that arteries will be able to expand and have an elastic recoil. Our next layer in our tunica is the tunica media. Media muscle, so that's going to be a layer of smooth muscle within our blood vessels so they can expand, which would be vasodilation, and if we want them to contract, they can contract, which would be vasocontraction. So the blood vessel will actually decrease in size. The diameter of the lumen, the hole in the blood vessel, will decrease in size. Once again, the arteries will have their extra layer of elastic lamina outside of the tunica media. So we find our elastic lamina just inside of the tunica media and just outside of the tunica media. And then our next layer is going to be our tunica externa. It will be a tough fibrous layer that will be a protective layer for our blood vessels. Now, looking from our first slide, we said we had arteries, which would be big blood vessels, like this guy right here. And then next we have arterioles, which could be little blood vessels, like this guy here. And then we have our capillary bed. So our capillary bed will be just one layer of cells thick. And the reason why they're only going to be one layer of cells thick is because we want gas and nutrient exchange to be able to happen, and we want stuff to easily flow into and out of cells from this area. Okay, now I'm going to come over to our vein side here. So we were talking about the similarities between arteries and veins, and I was showing you a couple things that the artery had extra that the vein didn't had, but let's look over here now. With our veins, they're going to have valves, which will be extensions of their endothelial layer. What these valves are here to do is these valves are here to prevent backflow of blood inside the blood vessel. So typically blood's going to be flowing up this vein, and sometimes if blood pressure drops, the blood's going to want to regurgitate or go backwards. So we have this valve here, and based on its shape is going to prevent blood from regurgitating inside the veins. Okay, Now let's look at some more differences between the artery and vein. So we looked at this picture and we saw that my artery had a nice shape to it and my vein was kind of collapsed. And we also see that my artery has a nice lumen that is of a defined shape. My vein, you can see the lumen, the middle of it. It could be quite large if this opened up, but right now it's collapsed. So looking here, the vein has a large lumen versus the artery will have a smaller lumen. The vein has a small tunica media, which is its layer of smooth muscle, versus the artery will have a thick tunica media. So it'll have a thick layer of smooth muscle. What you should be able to pull from that is that the artery is going to be able to contract, and vasocontraction of the artery will have a much greater effect on blood pressure than vasocontraction of the vein. And then our tunica externa will be similar on the two. Okay, so next slide. Once again, we're just checking this stuff out. So we go from the heart to our arteries. Alright, our big arteries are considered elastic, so they have a lot of elastic tissue in them, so they can expand and they can recoil. Next we get our muscular arteries, which are called the distributing arteries. So those will have a lot of muscle in them, so they can vasocontract and vasodilate very nicely to change the flow of blood. And then we get into our arterioles. And from the arterioles we lead into our capillary beds. Looking here, before we get into our capillary beds, we have these little structures here called precapillary sphincters. The role of a precapillary sphincter is going to be to decrease or stop blood flow into a capillary bed. Now, why might we think we want to decrease the blood flow into a capillary bed? The big reason why is going to be how much are we using that tissue at this moment. For example, right now I am sitting at my desk talking to a computer. I don't need to be using my skeletal muscles very much in my legs and in my arms. So these precapillary sphincters would mostly be contracted, so I decrease blood flow to my muscles. Why? Because it'd be a waste of energy. Now let's say that I was to go and start to exercise and do some sort of workout where I'm using my arm muscles and leg muscles, then we'll want to have vasodilation of these precapillary sphincters, or relaxation, to increase blood flow to those areas to bring nutrients and to get rid of waste products. Another thing that is very important on this slide that you're going to want to need for your study guide is going to be this chart right here. And we'll pull some information from this chart down here. So first off, we're going to have our systemic veins. Okay, let me change right here and pull out a pointer so I can draw. So it's going to be this chart, it's going to be this chart right here. Okay, so first off, we're going to have our systemic veins. Your systemic veins are going to hold up to 60% of your blood volume. That means our veins are our blood reservoir. With your systemic arteries, we're going to have about 15% of blood in there, about 12% in the pulmonary blood vessels, 8% in the heart, and 5% in the capillaries. This chart, once again, will be around for us to be looking at the differences between arteries and veins, and the different types of arteries versus different types of veins. So our first type of artery we had was an elastic artery. That's this guy right here. And if you look here, this shows us the thickness of the endothelium, how much elastic tissue is in that blood vessel, the amount of smooth muscle, and the amount of fibrous tissue. If you look at the endothelium, it's going to be the same for all of them. Why? Because we call that a simple squamous cell. So that means it's only one cell layer thick. Okay, so for our elastic artery, we're going to have a whole lot of elastic tissue as opposed to all the other blood vessels down here. Why? Because when we pump the blood in, the blood vessel will expand and it will have elastic recoil to help it pumping to its distributing or muscular arteries. So here are our muscular arteries right here. Now when we look at the muscular arteries, those guys are going to have a nice thick layer of smooth muscle in them. Why? Because we're going to want vasoconstriction to get blood to decrease blood flow to an area, or we'll want vasodilation to increase blood flow to an area. Working our way down a little bit smaller, here would be an arteriole. So once again, that's a little blood vessel, a little artery, and it'll have a lot of smooth muscle as compared to everything else. So once again, we can have a good amount of vasoconstriction or vasodilation to shunt blood flow to one area of the body or another. And then finally we come to our capillary. That's this guy right here. So it's just going to be one cell layer thick, and that'll be really, really nice so we can have good exchange of gases and nutrients and waste products. We get into our veins right here, our venules, so little veins. Those guys aren't going to have much elastic tissue to them, but they will have a small layer of smooth muscle so they can have some vasoconstriction and help to regulate blood pressure. And then we get our larger veins, which will have a little bit more smooth muscle to them, okay? And they'll have, once again, they'll have a little bit of elastic tissue to them so they can change their shape slightly. Okay, with our capillaries, we're going to have different types of capillaries. The reason why we're going to have different types of capillaries is we're going to want different types of exchange going on, different types of fluid. Sometimes we're going to want to exchange fluid, sometimes we're going to want to exchange gases, sometimes we're going to want to filter fluid, sometimes we'll want large chunks to pass through with the fluid. So based on what we want, we have our different types of capillaries. For example, we have continuous capillaries here. Since there's not many holes in them, these guys would be good to have smaller objects, such as gases pass through. So maybe we would find these in like the lungs. Okay, next one is fenestrated. So here's our fenestrated here. So with our fenestrated, there's these little holes poked in here. So since those are little holes, we can have a little bit larger things pass through there, maybe like liquids. So a spot where we'll find these is going to be in the kidneys. So in the kidneys, we filter our blood. What we do is we suck out all the plasma, and we take and then we'll pull out the stuff out of the plasma that we don't want. But this will just let the plasma pass and not the blood cells. And then the next one we have is sinusoidal. So look at these big sinusoidal holes in them. So we're going to be able to let fluid and other large chunks pass through. So we could let all of our cells, and we could let other stuff like that pass through there. Okay, so we're on to our blood vessels. For A&P2, this is going to be the one spot where you're going to have to do a lot of memorization. So for our lab exams, as you guys know, I like to use these pictures, and I like to use I like to use pictures from our text. So off of this picture here, some structures that I like to mark are going to be some of the larger arteries, of course, because we don't get a good description of the smaller arteries. So first off, here's our heart, and we have our coronary arteries on the heart. Coming out from the left ventricle, we're going to have our aorta. You remember we say up, over, and down. So we get our ascending aorta, our aortic arch, and then our thoracic aorta. Come in. Okay, so like I was saying, we go with our ascending aorta, or from our left ventricle to our aorta. We go up, over, and down. Coming off of our aorta, the way I like to remember this is B, C, S. So right here we have B, C, S. Let me pull a little pointer on here so I can write a little bit for us. So right here is going to be our brachiocephalic trunk, which will split into our right internal carotid artery and our right subclavian vein. Okay, our next one, C, will be our left common carotid artery and our left subclavian vein. Now with this, so we said brachiocephalic trunk, we get our common carotid, and we get our subclavian. Once we pass below the clavicle, this guy is going to turn into our axillary artery. Alright, so we have our axillary artery. Once we get from the axilla, or the armpit, into the arm, it turns into our brachial artery. Working our way down into the arm, we are going to have a split, and we will get our radial artery, hence it's traveling along the radius, and we will get our ulnar artery, hence it is traveling along the ulna. Now we're going to work our way down here with the abdominal aorta. Once the thoracic aorta passes through the diaphragm, it will turn into the abdominal aorta. Alright? Working our way down, we'll talk about these guys because we'll blow up a picture in a little bit, and we'll get these guys because we'll blow up a picture in a little bit too. But coming off here, we will have our right and left renal arteries. Renal is another way to describe the kidneys. And we're going to come down and we will have our common iliac arteries, our right and our left common iliac arteries. Our common iliac artery will split into an external iliac artery, which is right here, and an internal iliac artery, which is right here. And once it passes into the thigh, our external iliac artery will turn into the femoral artery. Okay? Here's our femoral artery coming down here, and as it gets below into the knee, the posterior aspect of the knee is referred to as the popliteal fossa, and we also have our popliteus muscle back there, so we call it the popliteus back there. Alright? Following down, it will split, and it will turn into an anterior tibial artery, which is in front of the tibia, and a posterior tibial artery, which is posterior to the tibia. Okay, looking at our blood vessels. So here's our aortic arch. So we go up, here's our ascending aorta, aortic arch, descending aorta. So we're taking a blow-up picture of the brachiocephalic trunk. Here is the brachiocephalic trunk. It splits into our right common carotid artery and our right subclavian artery. So let's follow the right common carotid artery up first. So here's my right common carotid artery, and it's going to split into an external carotid artery and an internal carotid artery. My external carotid artery is going to have a number of branches coming off of them. Okay, first of which is my superior thyroid artery. So it's superior and thyroid, so it's going to be the artery that is covering the superior aspect of the thyroid gland. Next one up that you guys are going to be responsible for is this artery right here, which is our facial artery. Alright, so it's going to go here and up and around on here. So this is our facial artery. It's going to be doing part of our face. And then working up, we got our maxillary artery, named for the region of the face it's going to be distributing to, which is the maxilla, or maxillary region. Okay, working our way up, our external carotid artery will give branch to the occipital artery. Okay, you can follow this guy right up here. And once our external carotid passes the zygomatic arch here, we refer to that as the superficial temporal artery. It's in the temporal region and it is superficial. So it's just telling us where we find it. Okay, let's work our way back here. Brachiocephalic trunk, subclavian artery. Coming off of here, we're going to have our vertebral artery, which courses through these vertebral foramina of the cervical spine. Okay, and we're going to have our thyrocervical trunk. So thyrocervical, thyroid and cervical, kind of makes sense. So we'll have an artery going to the thyroid gland, and we'll have an artery covering the posterior aspect of our vertebral bodies, or our cervical spine. Next one, we have our costocervical trunk. So we'll have an artery going down to distribute to our ribs, and we'll have an artery traveling right up our spinous processes of our cervical spine. And then, like I was saying, brachiocephalic trunk, subclavian, and subclavian artery will turn into the axillary artery as it enters the axilla. Now, what we're looking at here is we're looking at our vertebral arteries. Okay, so let me give you a spot. Here's a vertebral artery here, here's a vertebral artery here. Let me get a little pointer guy out here. So this is going to be, this right here will be our vertebral artery. Okay, as you can see, this picture here to your left is a drawn rendition of this picture to the right. What we're working on here is something referred to as the circle of Willis. Okay, so I'm going to backtrack for a second. You see our vertebral artery coursing up right here? So this artery, vertebral artery right here, we are going to follow its path here. So we're going to have a right and a left vertebral artery, right and left. Let me get this highlighter back out so I can draw for you guys. So we're going to have a right and left vertebral artery, okay, here and here. Those will fuse together to form our basilar artery. Okay, this guy's our basilar artery. Coming up, that basilar artery is going to split, and we're going to get a posterior cerebral artery on this side. Here's our posterior cerebral artery over here. Next, we get these guys, which are called our posterior communicating arteries. Posterior communicating artery over here. And our posterior communicating arteries will meet up with this guy right here, which is our internal carotid. This internal carotid artery, imagine it coming at the screen straight out at you. So it's that we would be inferior to it. So that will be coursing upwards from the neck into the brain, that internal carotid artery. Here it is on this picture. Here it is on this picture. Okay, so we have our posterior communicating artery, which will bring blood to both this internal carotid and middle cerebral. Okay? The reason for it is, let's say you get a blood clot right here in your internal carotid artery. Your middle cerebral artery right here would have no blood flow. But since we have a posterior communicating artery, that would take over the flow of blood. Kind of cool, huh? Next one. So we said these were our internal carotids here. Here's our internal carotids, okay? Coming off of our internal carotids, there will be our anterior cerebral arteries. This guy and this guy. Here's our anterior cerebral arteries. Okay, those guys will be doing the front of the brain, hence anterior cerebral, and they will be connected by this little guy right in the middle here. That is our anterior communicating artery. There is only one of these. There's not a right and left like there is with the posterior communicating. There's only the anterior communicating artery, which will be to connect our right and left anterior cerebral arteries. Once again, that will be there as a backup mechanism in case we were to have poor blood flow coming from one of the internal carotid arteries. Okay, let's get into blood flow of the arms. Alright, so we have our aorta. We go up, over, and down. So we have the ascending aorta, the aortic arch, and the descending aorta. Our branches off of the aorta are going to be B, C, S. Brachiocephalic trunk, left common carotid, left subclavian. I'm just going to work on the right side right here. So everything that I'm going to be describing on this picture will be from the right side of the body. So on your exams, I will expect you to be marking this as right or left. So if this picture is going to be on the right side, obviously, but I want you guys to know right side from left side. So we have our brachiocephalic trunk, which split into our right common carotid. Then we had our right subclavian, and it turned into our axillary artery, passing right here. Once we get a little bit further down, we're going to have a branch that will be called the posterior circumflex artery of the humerus, and then we turn into our brachial artery down here. Okay, and our brachial artery down here. Another artery that's going to be coming off at the same point where there's the division for the posterior circumflex is this deep artery of the arm, or deep brachial artery is another name for it. So see the way it goes posterior to the humerus and then it wraps around up front up here? Okay, there it is. And then we already talked about this brachial artery earlier. It comes down here and then it will split into our radial artery, which follows the path of the radius, and our ulnar artery, which will follow the path of the ulna. Next slide. So this is our celiac trunk. This guy right here that I am circling is our celiac trunk. I like to remember this as I like to remember this as HLS. We have our hepatic artery proper. So hepatic refers to liver, so that's going to be the artery to our liver. We're going to have our left gastric artery, okay? And then we're going to have our splenic artery, which will be the big blood flow to the spleen. Coming a little bit further down here, it's kind of hard to see, but this will be our superior mesenteric artery, which pokes its little head through right here. We're going to talk about that more on the next slide. Some other large structures that you can see here are our inferior vena cava and the abdominal aorta. Okay, this picture looks really messy, but it's not that bad. So let's take a peek at it. First off, here's our celiac trunk, and our branches off the celiac trunk were HLS, if you remember. So we had our hepatic artery proper, that covered the liver. We had our left gastric artery, and then we had our splenic artery heading to the vein. So let's work down now to our superior mesenteric artery, which is this guy right here. Okay? As we go with our superior mesenteric artery, it's going to have a number of branches coming off of it. First one is called the midcolic branch. So it does the middle of the colon. This guy right here is our colon. Your large intestine, another name for it, is the colon. So it does the midcolic. Another branch coming off of it right here, your right colic. So it does the right side of the colon. And yet another branch of it is right here, which is called the ileocolic. The reason why it has that name is it's going to have that name is it's going to be helping out with the ileum, and it's going to be helping out with the colon. Another set of arteries coming off of here. Okay, moving on. We have our inferior mesenteric artery right here. So coming off of our inferior mesenteric artery, we're going to have our left colic artery, which is going to help with the left side of the colon. Alright, and coming a little bit lower off of it, we will have our sigmoidal arteries. So these sigmoidal arteries are going to be helping out with the sigmoid colon, which is right here. And our last branch will be the superior rectal artery. So we'll be covering the superior region of the rectum. Alright, so let's do some more review. Here's our celiac trunk, our three branches, HLS, hepatic artery, left gastric artery, and our splenic artery. Here's our superior mesenteric artery. Alright, we had all of our crazy branches that were coming off of our superior mesenteric artery. So let's go through those again real quick. We had our middle colic for the middle of the colon. Right colic did the right side of the colon, and the ileocolic, which would do the ileum and the colon. Next one down, we have our inferior mesenteric artery. I'm going to flip back again, which did our left colic artery, our sigmoidal arteries, and our superior rectal artery. Note here, we still have our abdominal aorta, and we have our right and left common carotid arteries here. Okay, working down here, we have our right gonadal and left gonadal arteries. Okay, that can be testicular or ovarian depending on the sex of the person you are speaking of. Here we can see our right renal artery and our left renal artery. And then we have our right suprarenal artery and our left suprarenal artery. So supra is in superior or above the renal. So those do our adrenal glands. Working our way into the leg. We will have our abdominal aorta, which is going to split into our common iliac artery. And then our common iliac artery will split into an internal iliac artery, which is this guy right here, and an external iliac artery, which is this guy right here. The external iliac artery will split into this, which is the deep artery of the thigh, or deep femoral artery is another name it goes by, and this guy right here, which is just our femoral artery. Coming off of our deep femoral artery, we are going to have a lateral circumflex and a medial circumflex artery. So lateral is traveling laterally, so towards the outside or away from midline, and the medial circumflex is traveling medially. Okay, here is our femoral artery traveling down, 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 down. It passes through the adductor hiatus, and it will turn into our popliteal artery. Once again, we said this is a popliteal artery because it is in the popliteal fossa, and there is a muscle back there called the popliteus. Our popliteal artery will split into an anterior tibial artery and our posterior tibial artery, and your peroneal or fibular arteries. Okay, looking from the posterior view right here, off to the right, we're going to have our posterior tibial artery and our peroneal or fibular artery, which follows the path of the fibula. Okay, so our veins. Your veins and your arteries are going to be very similar in most instances. There will be a couple times where you're going to have some extra veins, and there will be some times where you won't have extra veins. But looking at the big picture here, we're going to have our superior vena cava, right, and our inferior vena cava. So superior vena cava drains the head and the arms. Inferior vena cava is going to drain the abdomen and the legs. So checking out the legs, here's our inferior vena cava. Will split. It will get formed by our common iliac artery will be common iliac vein will be formed by the internal iliac vein and the external iliac vein. That kind of makes sense, right? It follows the same pattern as arteries. Working our way down, we have our femoral vein, which turns into the popliteal vein. Okay, and then it will be the anterior tibial vein and dorsal pedis. So you're on the dorsal of the foot, and pedis is foot. This vein right here is our great saphenous vein. The great saphenous vein is going to be the longest vein in the body, and it is commonly used for bypass surgery with the heart, if you need coronary bypass or other types of bypass surgery. Just kind of a fun tidbit of knowledge. Here's the great saphenous vein again on this side, on the posterior view of the foot. Alright, and here's our popliteal vein. Okay, posterior tibial vein is coursing just behind the tibia, right there. Okay, next one. Here's our inferior vena cava. We will have our renal veins, alright, and we'll have some lumbar veins. And then we get our common iliac vein, our internal iliac vein right here, and our external iliac vein right here. Okay, we're going to talk about the hepatic portion. With this is we're going to have this blood vessel right here, which is our inferior mesenteric vein. That is going to combine with the splenic vein, and those two will combine with this guy right here, which is our superior mesenteric vein. Those guys take a detour. Instead of heading straight back to the heart, they're going to head over here to the liver. So hence it's called the portal system. So I'd call it like the hepatic detour system, or the hepatic portal. Instead of the hepatic portal circulation, you call it the hepatic detour. What's it going to do? Well, if you're checking this out, the splenic vein and the inferior mesenteric and the superior mesenteric vein are all draining our small intestine, large intestine, and our stomach. Why is that important? Because we're going to pick up a whole bunch of nutrients and gases and stuff from our digestive tract. When we get that material, it is raw material. It is not usable by most of it is not usable by our body. So what we're going to do is that stuff's going to take a detour. It's going to get dumped off at the liver. It'll get processed inside the liver, and then it can be sent back to the body through the hepatic veins. So it's kind of like a diamond. When you get a diamond out of the rough, out of the ground, it is just like, it looks like a white rock, broken ice. But you take it, you polish it up, and now it's useful. So for our digestive tract, we will soak up all those good nutrients and stuff and bring them over here by draining the inferior mesenteric, splenic vein, and superior mesenteric. Those guys will all drain into here, and they will be brought over to the liver. What's going on? Okay, so moving on. The hepatic portal circulation. I'm reading off this part right here off the bottom of the screen. The hepatic portal circulation drains the digestive viscera, spleen, pancreas, and they deliver this blood to the liver for processing via the hepatic portal vein. Like I said, it's kind of like the hepatic detour system. The liver will direct and maintain proper sugar, fatty acid, and amino acid levels in the blood. But it will also be changing all those raw goods that you just absorbed and make them usable for the rest of your body. Okay, we are looking at venous drainage for the head. So it's going to be pretty similar to our arterial supply. Slight difference we're going to have here is this guy right here is our internal jugular vein. This guy back here is our external jugular vein. For this, I'm just going to want you guys to know these couple sinuses. So here's our superior sagittal sinus, inferior sagittal sinus. This constitutes the straight sinus. Here's our cavernous sinus, and then we get a transverse sinus. So that's about all I want you to know from there. Okay, continuing on, looking at the thoracic cage, thoracic region, and the arm. So here's our superior vena cava. Draining into our superior vena cava, we're going to have this guy right here, which is the azygous vein. The reason why it's called the azygous vein is azygous means it is not of a pair. It is all by itself. It is singular. Another one we're going to have over here is going to be a hemiazygous vein. Sometimes they'll be here and they will attach the azygous vein to the hemiazygous vein. Alright, here we can see our external jugular vein and our internal jugular veins. Okay, we go brachiocephalic trunk, subclavian vein, we turn into the axillary, okay, and then our venous system to the main arm is going to be a little bit different than the arterial distribution. So check this out. Our axillary vein is going to split into the brachial vein and the basilic vein. Okay, you see how this basilic vein goes all the way down here? Also, we're going to have this guy up here that travels all the way down the arm again, and it's called the cephalic vein, as in cephalad, headward. Okay, coming across here, this is called the median cubital vein, because it's going through the cubital fossa. And we will have our ulnar vein coursing with the ulna, and our radial vein coursing the path of the radius. Okay, so we're looking at blood flow with baby to mom. I'm going to save this to chat with you guys about in lab, in person, so we can talk about this. This gets a little confusing here, and we're going to want to discuss this part in person. And that's it. I'll see you in lab.